Let me say good morning, wherever you are, good afternoon, good evening. This is African Actions Network 2A Radio TV, and today is Sunday, the 4th day of December. The year remains 2022. My name is Yubi Garnett, coming to you live from Montserrat County, the famous 72nd Barrack, Republic of Liberia. And so we thought to ascertain the views of citizens when it comes to the health sector of the country. And so we tend to hear from them what they make of the travels, what they make of the travels of officials of government when it comes to the health sector of Liberia, what have been their own experiences, and how can we make the health sector better. And so we've been able to speak with few community dwellers, and shortly we'll be speaking with few of them as you may be following, so you can share the broadcast. If you may, you can leave your comments and you can leave your questions as well. Those will be sent out for public consumption. And so currently I'm with a very early man in the community that I've chosen to also sit this interview. Good afternoon, sir. Welcome to African Actions Network.
Yes, good afternoon.
Your name, sir?
I'm really curious with them.
Miss, Mr. Slocum, how is the community?
The community is okay. And things are going fine.
Okay, that's good. How was service today? Because you know I've been around since morning. And
Yes,
folks.
our service was very unique.
Hmm.
And I thank the Almighty God that at least we were able to give us ample time and we went to service. Everything was unique.
Okay, let's hear from you. We are looking at the health sector as you earlier on informed. What do you make of the health sector in Liberia?
Well, it is very much disheartening when it comes to the health sector. Reason being, from my own observation, is that one, electricity, two, attendance to patients at the hospital or clinic.
Mm.
And three, I believe that there's a need after any medical practitioner has graduated, there should be some level of counseling. So as to what and how to maintain patients at the rural clinic or hospital.
So, have you had any bad experience when it comes to the health sector? Probably you got a life sharing experience you want to share with the public.
Exactly. It was like about 2006 when my little daughter was taken to Jean M. Davis Memorial Clinic, hospital, later taken at the JFK for operation. Unfortunately, while undergoing operation, electricity went off. And there was a severe blow, at which time, just in a few minutes, my daughter was announced dead.
Sorry. So let's look at the issue of our officials of government. Many a times we see them flying out of the country to seek medical treatment. And though we have big referral hospitals in this country, like the JFK, Tapeta, the Jackson Theatre Hospital as well. What is your own view about that?
Yeah, it's just a matter of being like they want to use what they call superiority. Because if they know that Liberia is a country and the medical bill was signed, and we have Rural Hospital, the Tabeta Memorial, we have the GFA, we have Redemption, we have Cali, and all the hospitals, they are now in Liberia, yeah. And we see that most oftenly, the common people run to the hospital. Reason being because we are not affordable to that financial level to travel from here. But it doesn't mean other hospital out there is better than some of the hospitals. I think we have some professional medical doctors here. And it is regrettable in a sense for government official who knows very well that this country is a country because bill have been passed when it comes to medical activities. And then we see them leaving the common people here, moving out of the country for treatment. Definitely it proves to us that Liberia or medical aspect is not up to standard.
How can we improve this?
This can be improved only when government invite those that are responsible for the medical activities and ask them, counsel them, call for a conference or meeting and ask them why it is that the common people always complain that when it comes to tragedy with government officials, they leave the country and the common people go to the hospital. And we always victimize when we come on hospital. I think they are afraid because they know the situation how it's like.
Hmm. And so, but do you think we can really change this, because this has been an age-old problem where we find many of our leaders, representatives, senators, even presidents dying outside Liberia because of ill medical conditions. Do you think we can really change this?
It can be changed. The system can be changed. It's only government put restrictive into place. Reason being, government is actually looking at this thing that is happening. People that have been put to the various positions to maintain, they are not working in line with the mandate that was given by the president.
But yet still, the same people still travel all Liberia to get medical treatment.
Exactly. We
So
see
are
the
they
day and
are
night.
they happy with the way and form or manner, so to speak, that common people live in this country?
Actually, for me, I'm disheartened, and I'll be bold to tell you, maybe if they are insane, I don't know, or they are unconscious carrier. Oh, you understand?
Mhm.
Because if you're a man with conscience, definitely I know that you will be part and concern of what is happening. Now they are well. You see ambulances flying with people. Sometimes as you get to the hospital, you say no bed. And no bed. Secondly, you will see people who can't say take the man to another area because you just a common man. If that was a big government official, a man with money, you will see them treat me to take somebody from on bed and give that person the first VIP treatment. I hope you understand.
Mm.
So I believe those that in the medical sector, they should be looking at the level of treatment that is unfolding at the federal hospital. They should be looking at it. Carry on cross-examination, do your inspection, ask for the attendance book, go through it, and sometimes it is good to interview the various patients and ask them as to whether how they have been treated at the various hospital because they're feeding the problem. Now these days we see medical practitioners they playing Zuma. They are on Facebook while patients are lying crying. It hurts people a lot.
But don't you think also the medical practitioners' actions also encourage government officials to fly out of Liberia? Don't you think so?
Exactly. Because they feel insecure. If they are seeing the common people running from place to place, this place, and sometimes you get to the hospital, there will be a lot of odor, different odor, and their way of living, if they see themselves, they don't want to get into kind of places. Rather, while it is true they are under air condition, flying vehicle with air condition, they want to be under that same air condition when they get at the hospital. And when there's no change in Liberia here, you have to go Ghana or try to another country.
So who do we expect to fix the system?
The government.
And they are the same officials of government
The
that are now
government
flying out of
are
Liberia.
fully held responsible for any other activities that goes on.
Okay, and so before I can leave you, let's look at the 72nd barracks. This is a very historical housing unit for the defunct AFL soldiers. Let's look at sanitation condition here.
Yeah, so for 72nd Barrack, yeah, I served as one of the former chairmen here. When we came here, when it comes to sanitation, this place was looking boring. And I believe that for those who reside here presently, because the place was abandoned before, but then since I was being here for a level of time, I think we try to improve the living condition. More especially, we have been dealing with Action A, Lasan, and other NGOs who have come to our aid. And we've got a pit latrine, which is called Taco Wawan latrine, is here, built, sophisticated, and we have some solar plate partner up our railway, and there are hand pumps being renovated here. I believe that the system is improving.
System is improving.
It's improving.
Okay, so lastly, let's hear from you because we want to take a tour around, but let's hear from you. What could be your parting comment before we leave you regarding the health sector of Liberia?
Yes, my parting comment is that I would love to inform those medical practitioners in regards to the attendance to patients, in regards to the counseling, in regards to molding their own mind, so that I beg them for human sake, because first preservation in life is safety. The next one, when you have life, I believe that you can do anything. So I beg them that they should try to improve the health sector and that every other clinic or hospital should ensure that electricity should be one of the priority. Electricity should be one of the priority.
Okay, thank you so kindly, sir. Your name again?
I'm Willie K. Slocum, Director of Security, Nelsta.
Thank you so much for talking to us. Well, folks, this is African Actions Network, 2A Radio TV.
Thank you.
We are coming to you live from 72nd Barrack and Painesville. And so we've been joined by another young, energetic Liberian. Your name, sir?
See US dialogue.
See, sorry, I hate to be tribalistic because there's a multicultural society. Are you from Nima County?
Great.
I love that
I'm from
county
a
so.
great country.
I love that country so dearly.
Yeah, you're welcome.
Welcome to African Actions Network.
Happy to see you.
Okay, see, let me just ask you this straight jacket question. What do you make of Liberia's health sector?
Well, first of all, I will tell you I'm happy to see you for this interview. But our health sector is very full, very, very full in this country. Very full. Why I mean by very full? Because do you think that people will leave here and go places like Ghana for treatment? Just of some minor problem, people with charter plane? It's wrong. You think why people can leave from Ghana to Kenya for treatment? Why people can leave from Sierra Leone to Kenya for treatment? Our health sector is very full. Very full. I will not tell you say our health sector is great. Even now you go to some area, you may ask me, say, oh, which hospital or which clinic you think that the area is good. Look at GFK. Look at GFK. Even here, WA. You go there, sometimes the people prescribe medicine for you to buy. So our health sector is very full in this country.
Now, I just thought to ask this question as well. You've been around in Liberia for a very long time, decades over. Have you experienced any situation wherein your friend, relative, or loved one got caught up, probably resulted to death as a result of the bad health sector? Can you share that story with us, please?
I will share the story. First, I will tell you my woman was suffering from cancer.
Cancer.
Cancer. And she was suffering from cancer. Get her to GFK. There was no medicine. That cancer left my old man to death. Today. But we didn't have money to transfer her to Ghana. We didn't have money to even transfer her to India because the doctor then said that this cancer we didn't have even treatment for it. I think we have to try to transport the woman to get her different. Alas, we didn't have money because we were from the poor background. How will we get money to charter plane or to pay plane ticket to go hotel bill, food money, and whereby again we're around here, I can go Nima County and bring my leg casao, bring my leg potato green from there. My woman will be eating. Allah will be her life. She lost her life.
But let's look at the hospitals. Do you think if you really have the money, the health facilities in Liberia can provide the treatment you need?
We need to reinvest. The people need to pull, the official need to pull in on the health sector in this country. That would be the help for us. Not everybody get money because they probably can fly to go. But we don't get money. First time, normal day, we used to go GFK. When you get so, sometimes they give you good penicillin injection. You go low, it's so gone. I start driving just in Liberia, the whole of Liberia. I start driving in 1983. I was living in Yekepa. I know how Yekepa was looking. I was living here. I know how GFK used to be. I know how Carry Hospital used to be. Even Copper Clinic on 12th Street. All the place were very renowned hospital. I used to go there and get good treatment. But now they are gone down. Gone down. So
Some will want to attribute the ravishing health sector to the civil unrest. How can you respond to that?
say that again.
The civil unrest. Some will say the health sector is ravaged or it has been damaged because we have war in this country for over 14 years.
Let's just say we have war. We have donation. So many donations have been coming to the country. I think you say you can see. So many donations have been coming. Some NGO have been donating some medicine to the very health center, but people take it away. People use it for themselves. They go and put it in their own drugstore, take it from the hospital, take it from the very warehouses, carry and put it in their drugstore. And when you go there, they give you paper, go to social drugstore and get a medicine. It's very wrong. It's very wrong. That's how we can get medicine. The people donate the medicine to the very health center. But they can't treat people. They will go and share it. We have more evidence on the thing there. Because we shall draw, we know, sometimes we know how many cartons people put it in. Various people there and carry to the various drugstore.
Private drugstore.
Yes, private drugstore. Someone who been seeing it. Been seeing it with our eyes. I work in a big renowned hospital. There's somebody come for treatment. How do I know that they get a medicine to certain drugstore? And you, the doctor, will tell me, say, go to the drugstore, then think on it. We think that drugstore belong to. So the health sector will need to really need to put seriousness about our health sector. Otherwise, there will be so many deaths that will be in this country. We need Liberia. Yeah.
Okay, now you're talking about the health sector, and people should do their utmost best to improve the sector. But every time we find officials of government flying out of Liberia to seek medical treatment, what is your own reaction to that?
Because they get money. They have money. You and I don't get money. We don't get money. If we have money, we will fly. But they have the money in their pocket. So they use the resources for this country to empower themselves. They use it to empower themselves. I'm just the driver. Something happened to me. Maybe I get in a 500 or 600 US, but able to sustain my health. Then I go, the people say, oh, the way you're looking, maybe you get cancer in the bone, you need to go places Nigeria, or you need to go to or India. How will I go? I will end up dying. All the food maybe they will call it, but the cancer will still be traveling. It happened to one of my best friends in Ghana. They may have cancer. There was no medicine. When they cut the legs, and then the cancer traveled to the other side, they cut it again. They left cutting it until they cut it almost to the top. They may end up dying.
So, do you think they are satisfied leaving the health sector this way and flying to other countries? Are they complicit?
But then flying in different countries to me, they're not too satisfactory. We also believe they are the head. They should be doing something better. They should be taking treatment. And if somebody sick, even people that work with them, they may be sick tomorrow. They will direct go to Susu hospital. It will be a renowned hospital. We get more Boko hospital. You go in Nima, we get hospital there. You get Methodist. You go in Senegal, you get a big large hospital there. Look at Tapetan, common example. You go build our hospital. But when you go there, no medicine. And when I give people donate the medicine, the people donate the thing, but they take it away. They take it away.
It's a sad situation, though, but I'm so much more interested in asking you, what is your health condition? Are you good?
By the grace of God, I live and better. Go down, I do my own traditional herb, my Yoruba, small things, sometimes I come myself. The continual process. So we get it.
So you subscribe to the traditional herbs, then even the uh, kui pills, how we call it, the
Yeah,
civilized pills or
yeah.
so.
Because what will we do if you don't get it means? When you go there, the red treatment, you're not getting it. You get it down on the traditional side. Sometimes when you are lucky, it help you. Sometimes when you're not lucky, it kill you. The guy looking. Because if we go on the visa, the people may say, go Nigeria. Where you getting plane ticket from? Where you getting money from to go there? Be buying food. Where you getting money from to go there and buy food? They flying from here, sell that money. You go there, you gotta lose yourself. And when you sick, you go somewhere, and not you alone going. You either be two or three. So where I think of for myself, I have my family, at least we are making it bit by bit. Uh, now we are in God here. Only God carry us through.
Only God.
Only God.
So, to recommend now to national government, how can we change this?
The only thing the government, I need to tell the government is all drugs need to be monitored. Any drugs that they bring into the country for any hospital health sector, it should be monitored. A warehouse manager there, he lists the drugs, and any drugs that are leaving, it should be account of it. I think it would be better in the country. But now something they just put in warehouse when John Brown ready, you say I have the staff, I have the procedure doctor, or your business cartoon in fact, my man, I'm taking this one, or native way we say, my man, you just give me 2 cartoon there. Then we don't know where you're carrying it. And what's giving on happen? So all drugs need to be monitored. All drugs need to be monitored. If we monitor the thing there, I think Liberia will be better.
Okay, so what's your name again, sir?
I'm saying US dollar.
Yeah, my name, my brother.
Yeah.
I love the GB for that place. So dearly.
And so you are welcome now. I'm happy.
So when you taking me, Nima?
Anytime you're ready, you come here.
Okay.
Come here, you will get me.
Okay, say thanks so kindly for honoring this interview.
Okay, you are welcome.
Well, we are still here in the 72nd community, talking to concerned Liberians regarding the health sector of Liberia. We've been joined by an elderly man. Your name, sir?
Samson Simon.
Mr. Simon, welcome to African Actions Network.
Welcome.
Thank you so kindly for, with a short notice, honoring this interview. Just to the point, what do you make of Liberia's health sector?
Our health sector is very cool because it's as I happened to me, my late wife died in childbirth when I was hospital.
Sorry.
Talking to a nearby clinic with Wayala, no good doctor, the method out there, gave her trade, clinic trade, she died in the hospital. So our health care in the country is very cool. We got hospital, no medicine. Go everywhere. Sometimes they sell medicine, they say, the medicine you gotta go buy it outside. In any hospital you see, big hospital you will see pharmacy around there. Another place that they're making out of it. Go there, buy the medicine. Someone sick, no medicine in the hospital, you get money, the person will die. So it's very cool. Seriously cool.
Sorry for your experience. It was a bad experience that you actually encountered. I'm so sorry. But more to that, those we have as elected and or appointed officials of government of Liberia, we always witness them flying out of the country for medical treatment. What could be your response to that?
And yeah, because they got money. And you that don't get money, you can't say you die. But they got money. They're using our resources to go out and go for their treatment and they go there they can be successful. So our own when you get money you die. You got no job, nothing. And we working. The instead we used to have bomb mine, we had Lanco, we used to got bombing hill. The people have a Google hospital, but now nothing like that. So it's very difficult.
So what can you say to them? Because many of them that are flying out of the country, as you said, they got the money. But do you think they can help change the lives of struggling Liberians? What can you recommend to them?
My recommendation here to our national government here is let it improve the health care, the health sector. At least let it get good budget for the health sector. Now all the people many I say making money, they that one, but the health sector first. Because we all help, it can be fine for all in the country. It can be fine, it can be good at all. People will die. No good hospital, yes. Hospital then yeah, but no equipment, no medicine.
So how the citizens will live and they don't get money, they're not working. Those that got money that they don't want can get a good treatment because they will not take treatment. They know they want to go to that hospital, they will not get medicine there. That's how they can feed them. So,
But can it really hurt you at times when you see your official of government going to seek medical treatment like in Ghana, neighboring Sierra Leone, and other countries? Can it really hurt you?
it can help us, but what we'll do, my brother, it can help us because your own country, with the kind of resources we got in your country, if you in the hospital, no medicine, the health center full. It's very difficult, my brother. I have to say, but it's difficult. But I
So,
see the people going flying out. It can make me very, but what we do? Nothing. They're in power.
so how can we change this?
We don't need good leader that will care for our people.
Well, you have a leader.
Yeah, we got a leader, but they don't care.
You say we need good leader.
Yeah, we need good leader, but if we don't have the, the position we're in now. This way is told us that we don't talk about politics, but
No, no problem. Just speak your mind.
the condition we're in now, actually we don't have good leader. Even down to our representative, our senator, even down to the president. Okay. Well, I've been here.
But the president is out of the country lobbying on your behalf.
That's not the first time. When they go, what they can bring, they see how money they go, they enjoy themselves. They come by nothing. That means I came here in 98. I worked with government before. I went at the executive mansion guy. And Erin King down south all completely. I've been here right now, the people are sick. But we are going to tell. Maybe see an interview. Someone will sorry for me. And it's over. Report that man for me. And they can call me. Yeah, but the health sector.
But can you actually? I'm so sorry about that. Sorry to hear that. Can you actually in any way, please? Can you in any way, please? Can you can you in any way kindly tell us? Probably you can go in detail, but to know what is what is happening with you. If you care to share it, please.
Yeah,
You
I
are
can
humble.
share it. I can share it.
Go ahead, sir.
Me, as I told you from the beginning, I have a serious problem about accuracy.
Accuracy.
Yes. And I've been going around some of our people who been with them, that they got money and go there, promise. It can't happen. Promise, it can't happen. But right now, I hear by the grace of God, but I can share it with you, maybe you will share it with the people.
People are watching you across the world already.
Yeah, so about me, I don't have no hope. Even to depend on representative, senator, president, no. Only by the grace of God, through the interview, someone can go to help.
Okay, sir. I'm so sorry about your ear health. Your name again?
I'm Samson Sion.
Samson Sign.
Yeah.
Can you kindly read out your number if you may?
Yes, I can do it.
Please do.
0776 80 90 64. My Lunsa is 0886 61 4941. That's my number.
Thank you so much.
Yeah. Thank you.
Mama Sion, right?
Yeah, Sion.
Okay.
You're welcome.
That's good. Well, folks, this is African Actions Network, 2aRadio TV. My name is 2aUV Garnet, and we are currently in the 72nd community. But as much as I do, I think you heard him read out his number. He's having serious health problem, and so hope you can also share with him what you have to make him become a very healthy person again. Or being joined by a very young man. Your name, sir?
Esmiana.
Sorry, I hate to ask this question. Which country are you from?
I'm an Imaya.
I love that kind of just telling someone I interviewed earlier on. Welcome to African Actions Network. It's good to have you on. But I'd love to ask the first straight jacket question. What do you make of the health sector in Liberia?
The health sector in Liberia need to really be upgraded because the condition of health centers are very not are really deplorable. So we need to seek and find best solution to see how best we can put things together and make our health sector very strong and or be active.
Okay, let me ask you this question also. There have been a lot of complications, people sharing their own life experiences when it comes to the health sector. Have you had any challenge, or have you lost a relative or family member, so to speak, or loved one, friend, as a result of a deplorable health sector, as you name it?
Yes, I lost my sister friend, on the issue where she was sick and took her to a nearby clinic in Lima, where they call it town Kanwi. And because of lack of health facilities, this woman couldn't make it, and today she's dead. So having poor health or situation in the country caused a very big problem. So I'm very, very apologizing to the government to try to see how best we can put mechanism together to make our health sector very unique.
Have you also had any challenge with the health sector personally?
Yeah, so I had internal emergency and I wanted to go for surgery at the Senekule home county at the Senekule hospital. And when we reached there, due to the deplorableness of the hospital, the people decided to send me as far as Tapeta. And I was constrained, I was feeling pain, but just because of course, power, I rode motor back. Can you imagine from Senegal to Tapeta, tell where I took my surgery? So if I couldn't have extend my life to as such a time to reach Tapeta, I could, I could die. So it's just because of God. So I went through the surgery and today I'm here.
Many at times, like October next year is coming, and we'll find Liberians going to the ballot box democratically to elect new leaders to steer the affairs of the country. So let's look at our officials of government, be appointed or elected. What is your own take on these officials of government flying all of Liberia to seek medical attention?
Um, I will just say it short. When you don't have food at your house, you go out for food because we don't have good health sector. That's what clearly is trying to manifest to us. But if you have a good health sector, they themselves going to have a treatment here. That's why in terms of any eventuality or tragedy, they always leave and go to another country for treatment. We know our health sector is old. That's why any sickness that can go those.
That's a Liberian song. Just reminded me. But let's look at a way forward. How can we change this?
Oh, we can change this by talking to our leaders, whether elected or appointed, to try and use their wholehearted strength to at least try to upgrade the health sector. We have spoke about this for a very long period of time, but no focus and we don't see no result from or redress from those people. So for me, I would like to apologize to the Liberian government that they try and strengthen the health sector not only for most Rwanda but all across the country in Liberia, so that people shouldn't be dying because of common cases at the hospital.
I just spoke with someone a couple of hours ago before we started this interview. The person was like, even we have the medicine, our medical practitioners also have serious challenges. Have you witnessed anything funny from our medical practitioners?
Most of the challenges in medical practitioner in the hospitals, I've seen some which medical practitioner just leave that job and someone sit on phone, play on phone while the patient is feeling pain, pay attention to the patient. They don't do it as per the instruction of the doctors. So we have many challenges. Well, for me, or with these challenges, as sure we can further make it to make Liberia health sector a better one.
Okay, what could be your parting comment before I leave you? I want to do a tour in this community, but let me just get your parting comment.
My party comment, the government need to work hard. You see, today election is coming. People are flying around how they want to saying how they want to re-elect another leadership. That can be sometimes a cost. So we are urging and we are appealing. We are not taking it by force. We are appealing to the national government to try to make our health sector strong. Because when it is so, we won't be spending unnecessary money living, paying plane ticket, buying plane ticket to go out of this country to go for treatment. That's a big disgrace, and we want the leaders of Liberia to stop these things are doing and focus on our health and focus on some social work that's supposed to be done to build the future of Liberia.
Thank you so kindly for speaking with African Actions Network.
Thank you.
Your name again?
My parents from my country.
Okay, so this is African Actions Network. We are still in the 72nd barracks, and we've been able to get in contact with another elderly fellow. Your name, sir?
Uh, I'm Moses P. Male, one of the senior member of this second barrack.
Welcome. Thanks so kindly for joining us. This is African Actions Network, and we are actually in this community this afternoon to get your own view when it comes to the health sector of Liberia. Can you kindly give us your candid opinion about the health sector of Liberia? Please.
What I want to tell you here, the health center in Liberia, as a way, happy,
Go ahead, Chief.
as a way,
I'm trying to quiet down the noise, but
No,
go
leave
ahead.
me.
Go ahead. You are
the
alive.
media is hearing me.
Yeah, just
As
go ahead,
a
sir.
way, you are on a fee
Mm.
to check on people, humanitarian system. The Liberia system is that way. Liberia will be fine. The way you all started the system, how are we living? We are living in deplorable condition. No mosquito net. Not a mosquito is in the environment. Look at the environment. Be flashing water.
I will do a tour here.
No, do that. Do that. See death. See death. Yeah. No water. Go see. I will tell you. No health system inspection. Means you have lack of health system inspection. Yeah.
Have you had?
Environmental system inspection. To have environments clear and clean, that you have community inspection. Even UNE will build that capacity to have community inspection. From there to district county level, it will be fine.
But let me just ask you this question. You've been in Liberia for decades over decades. What have been your own experience with the health sector? Probably your relative, probably a friend, a loved one. What have been your own experience? What have been
The
your
very
deepest
bad
regret?
one I saw in a summer when he called for amulet at night time, he didn't get it.
Hmm.
He called for amulet, my brain not that in my hand. And I went to hospital. He called for amulet. They gave me few, gave me 15 gallons before I come. Send it to our mobile. No amulet after 10 o'clock to eat. Full. In Liberia, I bet I challenge. You never see government amulet. Call to GFK. Get loud to them. Turn your leg. See, I need amulet in this community or be better pregnant. There's some area get cover amulet when you go. No government will not send amulet. Upon anything, the health sector is died, is down. No, because what? No focus and inspection. You know, yeah. I want to
I know how you
environmental.
feel. Sorry about that.
Eh?
I know how you feel.
No, seriously. How can you call amulet say GFK? You have been saying amulet to Joseph V. You using the control number, okay, carry, go there. Yeah, the way go there. Cobalt Clinic, go there. Nobody can help you. John Tebe, go there. Nobody will help you. No amulet, man, it's bad.
Let's look at medication as well. There are some folks that say the government facilities should be providing free medication for people, but now some are complaining that they cannot even get paracetamol at government facilities.
Because those that work there, they receive it and got their own pharmacy. They will prescribe the drugs for a prescription. They will prescribe the drug you go buy from their own pharmacy. They didn't test you, they will do your lab, they do your test and that, but to buy the medicine, you go buy it. They give prescription, you go buy it.
All of these challenges, we still move on to the ballot box and elect leaders. and we have also appointed officials of government that are paid with taxpayers' money. But we find them flying out of Liberia whenever they have serious medical issues. What is your take about that?
Oh, I want to ask you, what's your name first?
I'm Garnet, as I said earlier on.
Ghana
Tar
who?
Garnet.
Charles Ghana.
Tar Garnet.
Huh?
Tar Garnet.
Tar Ghana.
Sure, sir.
From where? Yeah.
I'm from Bassa, but I'm a Liberian.
Yeah, man, that mean we are chairman, this is the media, man.
So,
Tar Ghana.
yeah, so
I
we
wanna
just do
tell
a
you.
handshake.
Yeah. What happened there is the head center, and I'm fine. He discussing by Salomon giving the people you go on media, you see the people in the control room. You only see them on Facebook. You don't care for people.
So does this action justify why government officials will fly out of Liberia when they are sick?
But for example, somewhere 12, the incident that took place, they left the driver and the security and took his wife and his son out of the country. I can prove it now.
Yeah, but
So in the direction, the big people who don't care for themselves in the health sector, they don't care to maintain the popularity in the health sector. They don't care. They don't face it. When you saw the health minister visit hospital, it's like priority. So they oh GFK, this man time, man, what's going on here? Nothing like that. The health minister said that yeah. All of them going to work forward, they want the priority. So,
how can we change this?
We'll change it by ballot bag.
By the ballot box.
Yeah, ballot bag.
But you've been going to the ballot box for decades, centuries now. Do you think it can change this time?
Everything is about Almighty God. No God can change. Like,
But
not me, it's not you. It's not me, it's not you. From eating 47, like brother said, testing the water, and they will find the best person like those of God.
But are you happy about this? Each old country still testing water. Are you happy about that?
Yeah, no problem, man. You can approach 25 with me, you'll find one.
I like that. You
No
just
problem.
made my day. That was a nice one. But your name again, sir?
Yeah, I'm Chief Male, Chief General Moses Male, one of the former ex-general of God, like you are. A decent man who control this barrier. As he said, he's saying now your own environment control, your own setup. All the place see people that been interviewing with you, they are all my team. We base here, we control this barrier.
Okay, just
Yes,
before
soldier.
I leave you, I just have to just chip this in. Sorry, I didn't mean to ask this question.
Yeah,
I'm so much more concerned because from the earlier part of this regime, there was a notice for evacuation. Have you guys resolved that now?
You go get control what the government. You got control 100% what the government. That you take. Your own child in his house.
So it has been resolved.
Yeah, it's done, man. It's done.
Thank you so kindly for speaking with us.
No
It
problem.
was a wonderful interview.
Yeah, I just.
Okay, thank you, sir. Okay, folks, we are still in the second community, and I just thought to take a tour around this community. Looking at the health sector of Liberia, you've been listening to Liberians expressing their own views purposefully. We've been hearing a lot of disappointing statements, so to speak, as it relates to the health sector of Liberia. And I have been fetching a female to join us as well. But delay, and getting Liberians to speak to some of these issues, sometimes very troubling. But as much as I do, I just want to take a walk through the community, and then thereafter, we will coordinate a day on this special community outreach with African Actions Network. My name is Yudi Garnet, and I have been tipped that there are some deplorable areas in this community because some of these things also cause serious health hazards. So if you cannot practice good hygiene, good sanitation, you should expect that there will always be hazards in your community. So as you can see, this is just a stone throw from the main road. As you can see, that is a main road, the SKD Boulevard Road. It's a major runway in Liberia. And now see how people live here. So our living conditions should also be important. Our personal hygiene should also be important as well. And so it has been a wonderful time getting views of Liberians regarding the health sector of Liberia. They've also called on government, they've challenged government, they've challenged medical practitioners, and they've also challenged community heads to ensure that the health sector is worked on by everyone. This cannot be achieved alone. This is a collective process. And so for African Actions Network, 2A Radio TV, my name is Tar Yubi Garnet, and I brought you this special community outreach on the health sector of Liberia and how Liberians feel about their officials that they elect pertaining to travel all of Liberia to seek medical attention. I want to say many thanks to all of those that joined us on this interview. Many thanks to Patience Blay Atto, who sat at control in Pennsylvania and USA to stream live this program live for us this afternoon in Montserrat County. Until then, have a wonderful, wonderful first Sunday from Liberia.